Hi, my name is Dr. Joe Childs and I'm a board-certified chiropractic neurologist. And on this DVD today I'm going to talk to you about restless leg syndrome. I'm going to talk to you about our drug-free restless leg syndrome program. We're going to talk to you how you can overcome those jumpy legs, those legs that have that achy, that strange feeling at night that makes you have trouble sleeping, that gives you insomnia, that just bothers you through the night and it's really affecting your life. We have a program that we do that has been helping people with restless leg syndrome, and we get amazing results. And what we're going to do today is we're going to tell you why that is and what exactly we do to help patients with restless leg syndrome. The great thing about the program is it's drug-free. Typically, the drugs that are used for restless leg syndrome, Neurotransmitters is one, gabapentin, Requip is another one. These are drugs, and the problem with these medications is that they actually don't get at the true cause of the problem. What they do is they, just like all drugs, mask the symptoms. They mask the restless legs, but they're not fixing the true cause and the reason why you're having the restless legs. The other problem is these drugs, the Neurotransmitter, the gabapentin, the Requip, they really kind of slow down the way the brain functions, and they can do a lot of things. They can really reduce your blood pressure, which you would think that would be good, but it's not really so good because a lot of times people will get a lot of drowsiness, a lot of dizziness. They may have trouble with their own voluntary movements, which means they have trouble moving as good as they'd like to move. They may have nausea, vertigo. These are all symptoms that these drugs can cause. Now, I will let you know that as a chiropractic neurologist, it's not my job to put you on drugs or to take you off of drugs. That's, I'm not licensed to do that. So I'm not telling you you need to go off of your medications. You need to actually go see your medical doctor if you want to go off for your medications. But what I will tell you is the patients that do our brain-based care, and I'm going to tell you about that today, they're able to get off of their medications. And what happens is as they get healthier, as they get their body functioning and their brain functioning better, we send them off to their medical doctor who put them on the medications, and the doctor is pretty pleasantly surprised that you can actually go off the medication. So we'll talk about it. So let me tell you a little bit about myself. Again, I am a board-certified chiropractic neurologist. Now, just like in medicine, you can be a medical neurologist. You can specialize, medical neurology, medical orthopedist. In chiropractic, you can also specialize. You can do continued schooling. You can go for another 2 years beyond the chiropractic curriculum, and you become a board-certified chiropractic neurologist. Now, the difference between a chiropractic neurologist and a medical neurologist is we do not treat with drugs or surgery. We treat with specific types of brain stimulations. We're going to talk about that today. And we treat with functional medicine or medical care, or drug-free metabolic care. Again, I'm a doctor of chiropractic. I'm fellowship trained in functional neurology, which basically means drugless neurology. I'm fellowship trained in childhood neurodevelopmental disorders. So we see kids with ADD and ADHD and things like that. I'm trained in functional nutrition and functional medicine, which means that we do a lot of nutritional care. It's very important for people with restless leg. And I'm also trained in blood chemistry, and I'm also trained in spinal decompression and biomechanics. I'm an exercise physiologist, and I'm also trained in chiropractic pediatrics. So that's a little bit about me. I've been in practice for 11 years here in Chester County, Pennsylvania. So what is it that makes us different than every other doctor you've seen? I'm sure you've been to a lot of doctors trying to find out why you don't sleep well, why your legs they feel like you got this involuntary movements, why they feel like they're twitching or burning, or they got this achiness in them at night. Or even during the day for that matter. So what makes us different? Well, here's the deal. We treat restless leg syndrome metabolically and neurologically. That's the missing link. We treat patients, again, metabolically and neurologically, left hand, right hand. Okay? So the reason why we do that is we want to get to the root cause, and we're going to leave no stone unturned in finding out the cause of your restless leg syndrome. We don't want to just cover the symptoms up with medications. We want to find out the cause. So if you're watching this video right now, basically the reason why you're watching it is because you have a loved one or yourself that's dealing with restless leg syndrome. So it's going to be very eye-opening, the information I'm going to share with you today. So restless leg syndrome is a neurologic metabolic condition. Your brain, your central nervous system, your brain, your spinal cord, needs two things in order to function properly. It needs fuel and it needs activation. Fuel is in the form of glucose, which is from the food we eat, from our metabolism, and it's also from oxygen. So oxygen is key in treating in patients with restless leg syndrome. And number two is activation. It needs stimulation, and so we use specific brain stimulations to affect people with restless leg syndrome. So fuel and activation. So again, the fuel side is the metabolic side. That's the oxygen, that's the nutrition, and The stimulation is the neurological side, metabolic and neurologic. So what do I mean by metabolic care? So we need to run, if you have restless leg syndrome, complete metabolic panel. We need to run a lipid panel. We need to run a CBC with auto differential. We need to run a thyroid panel. We need to run your thyroid antibodies. Okay, we need to run a complete thyroid panel, not just TSH. We need to run everything. We need to run free T3, your T3 uptake, again, thyroid antibodies. Now this is what everybody says to me, well, Dr. Childs, I've already had these tests and my doctor tells me they're normal. They're not normal. The reason why they're not normal is because of this. When your doctor looks at your ranges, what they use is they use the laboratory ranges. The laboratory ranges are the right-hand column when you look at your blood work. Those laboratory ranges are developed, and the way they develop them is they develop them as the average of every single person giving blood in all the different blood places where you can actually have your blood drawn in the whole country. So basically you're the average of everybody. Now if you look at some of the people that go and have blood drawn, they're not so healthy. They're pretty sick population if you look at that. So you're really the average of pretty unhealthy people. So we use what's called the functional lab values. We're going to look at optimal ranges. Optimal ranges are more tight. Okay, so let's look at this. This is why you can go to your doctor, you can say, you know what, all your lab ranges are fine, and you can still feel bad. You can still have chronic problems. You can still have restless leg syndrome. So here's an example. Glucose, for instance. The functional range for glucose, the optimal range for blood glucose, sugars in your blood, is 85 to 100. That's what you need to have. Where the traditional, the lab ranges are 65 to 110. 65 to 110 as opposed to 85 to 100. So that means you could be 109 or 110 and you're considered normal, and that's only 17 points away from being diabetic. Or you can be 69 in your blood sugars. That's hypoglycemia. That affects your brain. Okay, so we look at things in a much tighter values, and that's why we get people well. Okay. The other thing we want to do metabolically is we need to do an adrenal stress index. Patients that have insomnia, patients that have restless legs, this is essential. This looks at your adrenal glands. Your adrenal glands sit right up on top of your kidneys, and they are your stress glands. Okay? Patients with insomnia and restless leg syndrome and chronic pain, but definitely restless leg syndrome, they have adrenal glands that are completely stressed out. They're either creating too much cortisol or they're actually fatigued, they're shocked, they're drained. Okay? And that can affect the way you sleep, and it can affect the way your nervous system functions. So we need to run this ASI, Adrenal Stress Index. It is a salivary test that looks at, it measures DHEA levels, it measures your cortisol levels, and we measure at different parts, different times in the day. We measure it in the morning, mid-morning, afternoon, and at night. And so it's going to let us know what is your cortisol rhythm and how it works throughout the day. The adrenal stress index is, we're going to see this circadian rhythm. Circadian rhythm means how is sort of the rhythm that your body goes through during the day. And so you should have high cortisol in the morning and low cortisol at night, and that's what allows you to sleep properly. Okay, so if that's off, you're not going to sleep well. You're going to have restless legs. You're going to have problems like that. Okay? The other thing we run is sensitivity testing. A lot of patients with chronic conditions like restless leg syndrome have sensitivities to certain foods. We're going to run the big five. We're going to test you for gluten sensitivity. We're going to test you for casein sensitivity, egg sensitivity, soy sensitivity, yeast sensitivity. Dr. Childs, I've already been tested for gluten. They thought I had celiac disease and I came back negative. Celiac disease is a genetic allergy. It's a genetic intolerance to wheat. And that test is not accurate enough to determine if you have a sensitivity to gluten or casein. Sensitivity testing, it's a test is going to determine if you have sensitivity to gluten, wheat, rye, oats, barley, milk, eggs, yeast, and soy. If you're sensitive to any of those, it can be causing inflammation in your body and inflammation even into your brain. Okay? Patients that have these sensitivities may have chronic pain or fatigue, frequent indigestion, fullness after meals, bloating after meals, frequent loose bowel movements, constipation, they may vomit often, or they may have no symptoms at all. Because sensitivities, they're called Igg reactions, they can actually affect the way your brain functions. And the reason why they do it is because a lot of people have what's called a leaky gut syndrome. And when you have a leaky gut syndrome, your intestines become too permeable. Your intestines are supposed to block and only allow through fully digested food particles into your bloodstream. So it's a barrier from the inside of your intestines, which is really the outside world, and your bloodstream. So when we eat food, our food needs to be digested fully, down from proteins to peptides to amino acids. And the only thing that can fit through are those little small amino acids. And when they get into your bloodstream, your white blood cells and your antibodies cannot detect these small particles. But what happens is when your gut becomes leaky, whole proteins and peptides get through the leaky gut. And when they get through the leaky gut, your immune system thinks that they think that they're an antigen. They think that it's a bacteria. It thinks that it's a protein like a virus. And so your own immune system starts attacking this food. If you're sensitive to it and you keep eating it and you have a leaky gut, it eventually is going to create inflammation in your body. And that inflammation is considered an autoimmune disease. Autoimmune means self-attacking. It means your immune system, instead of attacking viruses and bacteria, starts to attack self. And that creates inflammation. So a lot of people with neurological conditions will have inflammation in their brain. And it can create inflammation that causes your brain not to fire well. In fact, we can run a test for cerebellar antibodies, which is the back part of your brain. And so a leaky gut is very important. We can test for leaky gut. We can test if you have an autoimmune disorder. If you have an autoimmune disorder, it can create brain inflammation. If you have brain inflammation, you can have problems with the way your nervous system functions, which can cause restless leg issues. The immune panels are essential. They trump everything. A couple important things. It goes like this. Autoimmunity. We have to determine if you have that. Okay. Number 2 is anemia. Anemia is a big thing. Okay, that's number 2. And then we move into like blood sugars, and we move down into adrenal functions and things like that. But autoimmune, it trumps everything. Your immune panels, we run in our office, we run T and B lymphocytes, we run the cytokine panels, which are your interleukin 2, TNF-alpha, interleukin 4, and interleukin 10, and we run what's called natural killer cell activity. These are the inflammatory mediators of your immune system. There's 2 parts of your immune system, Th1, Th2. Th1 are the soldiers that go out and do the fighting. Th2 are the antibodies. They don't do the fighting. What they do is sort of tag everything and say, hey, this is what the T cells should attack. So Th1 is interleukin 2 and TNF-alpha. We can test those cytokines. And we can test Th2, which is interleukin 4 and interleukin 10. If you have a Th1 that's higher than Th2 or Th2 that's higher than Th1, you have what's considered an autoimmune disease or an autoimmune disorder. It's an underlying autoimmune disorder because it hasn't turned into rheumatoid arthritis or lupus or anything like that, but it means that your immune system is not working well. It needs to be balanced. We can check and see if you have that balance. We can find out if you have an active antigen or immune dysregulation. Active antigens are things like parasites, bacteria, viruses, mold, yeast, fungi, protozoans, chemicals, heavy metals, and foods. The biggest ones are, again, the gluten and things like that. So if you continually eat gluten and you're sensitive, you are continually causing high inflammation in your body. So the best indicator if you have an active antigen, which means you have something active that your immune system's trying to fight, whether it's a parasite, a bacteria, a food, something like that, is what's called the Cd4 Cd8 ratio, which is the helper-suppressor ratio. If it's above 2.5, then you have some type of active antigen. We need to find that out. If it's below 2.0, then you have immune dysregulation, which means your immune system is not working good. Secondarily to you having anemia, you having adrenals that are not working, and we can look at that from the ASI. You have blood sugar issues, things like that. We can run what's called a DNA stool ecology, and when we run that, it's going to let us know your gut composition. We're going to find out, do you have dysbiosis, which means you have improper levels of healthy bacteria, usually secondary to antibiotic use? Do you have parasites? Do you have yeast that's overgrown? Yeast causes a leaky gut. We can run H. pylori. H. pylori is an upper digestive antigen. It's a bacteria that will affect and create some acid reflux, things like that. Inflammation, we can check you for inflammation. People that have neurological disorders, and again, restless leg syndrome is a neurological disorder. They usually have high inflammation. People that have autoimmunity have high inflammation. So we can test you for homocysteine and C-reactive protein. They're also good markers for having cardiovascular risk. We can look at neurotransmitters. Patients that have restless leg syndrome almost always have a problem with their neurotransmitter system. They may have too much dopamine or too little dopamine. Typically, they're going to have not enough GABA, And what will happen is we can use specific types of neurotransmitter supplements that can facilitate GABA synthesis. It's called gabatone. Sometimes it's serotonin, sometimes it's acetylcholine. We need to run special testing to find out about your neurotransmitters. We do specific surveys and things. Hormone panels. A lot of times patients will have troubles with their hormones that are causing these issues. So we need to test all these things. Then once we find out what's going on metabolically, we've only talked about metabolic stuff so far, then what we do is we put you on a specific nutritional protocol with specific supplements, specific diet. So it's not just a diet that says, hey, I think this is good for restless leg. It's a diet that's going to be specific to whatever your testing comes up with. Okay? We also use glutathione. Glutathione is a very powerful antioxidant. It's the most important one in your body. And so we can give you supplements that will help increase the levels of glutathione in your body, or we can actually have you take glutathione. You can't take it orally, by the way. You have to do it either via nebulizer, or you can do it using a cream. And when we use this glutathione, that's very important to make certain parts of your brain healthy that aren't so healthy when you have restless leg syndrome. So the question is, have you had all these tests? You know, you went in to see your doctor and you said, I have restless leg syndrome. Did he say, well, we need to check you for food sensitivities. We need to find out why you're having this problem. We need to check your adrenals because that can really affect your sleep and affect your insomnia and things like that. Did he say that? No. What they did is they said, here, try this drug, right? Because the reason why is these doctors are not trained in doing what's called functional medicine. Functional medicine means drug-free medicine, means using nutrition and using special tests. Most of the time, your doctor is not going to know to run these special tests. Okay? The other thing we do is we do neurological treatments based on specific neurological testing. So we need to find out which part of your brain is not firing very well. Now here's the deal. Patients with restless leg syndrome will typically have an upper brainstem. It's called the mesencephalon. It'll be firing too high. When it fires too high, you don't sleep well. There's an area in your upper brainstem called the mesencephalic reticular activating system. It keeps your brain awake. It also keeps your brain active, too active, and it causes like involuntary movements. And so this is the way it works out. When you look at a person's brain, this is called the cortex, this area in through here. And the cortex is broken up into frontal lobes, parietal lobes, temporal lobes, and occipital lobes. And then underneath here you have the cerebellum, and then you have the brainstem. You have a lower brainstem and an upper brainstem. The lower brainstem is parasympathetic. It's more relaxation. It's going to allow you to have a good night's sleep, things like that. The upper brainstem is arousal, movement, things like that. And so what typically, the way the brain fires is the cerebellum fires to the brain. And then the cerebellum, which is the back part of your brain, which controls balance and coordination, the cerebellum fires the brain. And then brain fires down to lower brainstem. The lower brainstem keeps the upper brainstem in check. So if you have a low-firing lower brainstem, it's not going to keep the unruly teenager, which is the mesencephalon. When it fires too high, you get issues. One issue that you get is restless leg syndrome. Okay, the other thing you may get is insomnia. Some patients with high-firing upper brainstems will get chronic pain. They may get migraines. They may get increased sweating, different things like that. So it needs to fire at a normal level, but if it gets going too fast because the brain's not firing well, then you have trouble. How does this happen? Well, metabolic stress, we just talked about it. People that have the autoimmune issues, it affects the way their brain and their cerebellum fires. People that have adrenals that are way out of whack, that are too low or too high, that's toxic to your brain. So metabolic stress, emotional stress, people with long-standing emotional stress, it can affect the way your brain functions. Now I'm not talking about like brain tumors and strokes and MS. I'm talking about sort of areas that are weak and sort of areas that are too strong. They're not balanced. Physical stress, people that have had car accidents, people that have had sports injuries or falls and things like that, that can affect the way the brain functions as well. So what we do is we do a comprehensive neurological testing. Again, I'm a board-certified chiropractic neurologist, so we do functional neurology. We're going to look at right and left blood pressure to see if there's differences from side to side. We're going to look at tissue oxygen saturation and perfusion. How well is blood getting out to your extremities? Heart rate, heart rhythm, salivary pH tells us a lot about your oxygen levels. We're going to look at all your reflexes. Typically, patients that have restless leg syndrome, they got real jumpy reflexes. We're going to look at eye tests because your eyes are the window to your upper brainstem and your lower and your middle brainstem, so we can get an idea how that's working. It also lets me know how the cerebellum is functioning in the frontal lobes. cranial nerve tests, which are all the nerves that come off the brainstem, and then we do very specific cerebellar tests, which is coordinated movement and things like that. These are all off in patients with restless leg syndrome, almost always. So once we find out what your problem is, the goal is to get your brain firing better and functioning better, and certain parts of your brain calm down. We want to calm down the upper brainstem. And so what we'll do is we do what's called oxygen therapy. We put our patients on exercise with oxygen therapy. And what that does is it'll slow down the fast-acting upper brainstem that's causing the restless leg, and it will speed up the brain. And so the brain will inhibit that mesencephalon. So we put all of our patients on oxygen therapy that have restless leg syndrome and chronic conditions. We're going to do interactive metronome. Interactive metronome is a computer-based program that uses auditory stimulation and visual stimulation and motor stimulation, and it trains a part of your brain called the basal ganglia. Now the basal ganglia is very important because the basal ganglia is very important in inhibiting movement. And so when that upper brainstem gets going too fast, it's going to fire up to that basal ganglia improperly, and what will happen is the basal ganglia will not do its job in inhibiting movement. So patients with restless leg have a problem with the circuitry in their cerebellum, in their frontal lobes, and also in their upper brainstem and in their basal ganglia. Well, this interactive metronome, you see this girl using it right here, trains the cerebellum, and it trains the frontal lobe, and it trains the basal ganglia. We may do OPK tape, or eye exercises, or hemi-stim, visual stim. Okay? The interactive metronome, again, affects the dorsolateral prefrontal cortex in the brain, which is a center that is important in modulating the mesencephalon, the basal ganglia, the cingulate gyrus, and the cerebellum. These are all parts that the interactive metronome improves. Okay? A lot of patients with restless leg syndrome also have a lot of back issues. They may have problems with their lower back because the nerves from the lower back go down in the legs. If those nerves are constantly irritated, we can have problems. So we do specific types of therapy. It's called the active therapeutic movement. This is for patients that if they bend or they twist or a sleeping position hurts, we can start to exercise them in certain positions and take pressure off their nerves. A lot of patients with restless leg syndrome have herniated and bulging discs in their lower back, and that's putting pressure on the nerves in the lower back and can create neuropathy in their feet, or can create numbness and tingling in their legs and things like that. And so we do a therapy called spinal decompression therapy, which takes the pressure off the discs in the lower back. The other therapy that we do for patients with restless leg syndrome is we do spinal correction. A lot of people have very poor spinal health that have restless legs, so we want to make sure that we do strengthening exercises, gentle chiropractic care in certain areas if it's needed. Laser therapy, we do laser therapy, and we do what's called a rebuilder and a health flight booty. So we can do laser therapy on the nerves in the feet and in the legs, and we can also use something called a rebuilder, which is going to be electrical stim, very light current electrical stim that actually helps improve the frequency of firing of the nerves in the legs. So all these things we can do to help patients with restless leg syndrome. So I got a couple questions for you. If this all makes sense to you, and you're dealing with restless leg syndrome, don't you think it's kind of important that you treat and find the underlying cause instead of just masking it with the medications, the Neurotin, the gabapentin, and the Requip? These things have side effects. And so here's a couple questions I have. How has your restless leg syndrome affected your relationships with your family? How about your finances or other activities? Are you enjoying life to the fullest? Well, if you can't sleep because your legs are bothering you all the time, you're not enjoying life. Sleep is vital for you to be healthy. Another question, what has your restless leg syndrome cost you in time, money, happiness, and sleep? Well, it's obviously cost you time, money, and time and sleep, but how about happiness? I mean, if you're not feeling your best, and you're just not going to be enjoying life. That's the bottom line. The last thing is, where do you picture yourself in the next 3 to 5 years if the true cause of your restless leg syndrome problem is not corrected? These things tend to get worse over time. The longer you age with these things, the less your brain is functioning as well as it could, these things start to get worse. Okay? And what is it worth to you to get fixed? Now, the reason why I ask you that is because doing the things that we do in the office, it takes a little bit of effort. You know, if we find out that you're gluten sensitive and it's creating brain inflammation, we're going to need you to make that change. Are you willing to make changes? Okay? Or are you just looking for something to cover up the problem? Because we're, again, looking for the true cause of the problem, and we leave no stone unturned in helping patients with this type of problem. So I do appreciate you listening to this video. If you would like more information, what you can do is you can put your name in down below, and we will send you information on how to get a reduced cost restless leg syndrome consultation and neurological exam. If you already have come to our office, watch this video. If you're coming back with your significant other, have them watch the video, and we'll go over the findings and any recommendations for labs when you get back. So again, thanks a lot. Take care.